You're not behind. You're not failing. You don't have to make a choice. You're not required to choose at all, and let alone from a place of fear. This isn't a test of your toughness or the best decision making. It's really about your body's decision, and it deserves time, tenderness, and clarity. You don't have to bully yourself into certainty. You can gather information and still honor your capacity. So you could gather information and not do anything with it. Hey, beautiful soul, and welcome to Dear Body, I'm Listening, the podcast for women navigating chronic symptoms, invisible illness, and that daily dance between hope and exhaustion. If you've ever been told it's all in your head, well, this podcast is for you because your body is not lying and neither are you. Hi, I'm Donna Piper, movement therapist, Pilates instructor, and chronic illness navigator. After years of being dismissed, misdiagnosed, and doing everything quote unquote right, but still getting sicker, I created this space to tell our truth. Here we talk about swelling, brain fog, nervous system crashes, and the kind of symptoms that don't always show up on lab results. We're going to explore lymph, breath, movement, self-trust, latest research, books, relationships, basically everything. All from a place of compassion and honesty. This isn't about fixing your body. It's about finally being heard and getting some answers. Hey friend, running low? Me too. I'm Donna. This is Dear Body, I'm Listening. We're in it together. Hey love, welcome back to Dear Body, I'm Listening. Today we're talking about a question that can quietly hijack your brain for months or sometimes years. Lipedema surgery versus non-surgical care. Do I have to choose? And if you don't even have lipedema, stay with me. Because this episode is really about any body decision that comes with pressure, money, fear, and that awful feeling of, if I pick wrong, am I doomed? No doom here, just truth, options, and a way out of the panic loop. So if you've been stuck in the lipedema decision spiral, it usually sounds like this. If I don't get lipedema surgery, am I giving up? Will I get worse? What's going to happen? And if I do get liposuction for lipedema, am I being reckless or vain or dramatic? Or what if it's worse afterwards than it is right now? Or if I'm still doing compression garments, manual lymphatic drainage, walking, strength training, and anti-inflammatory eating, and my legs still hurt, what does that mean? Why does everyone online sound so sure? Well, I'm over here trying not to cry in the shower. And then on top of that, that financial reality. Lipedema reduction surgery costs can be huge. Travel, time off work, compression, aftercare, swelling management, caregiver support. This is not a casual little self-care treat. This is a major medical and life decision. So if you feel overwhelmed, you're not bad at making decisions. You're responding to a situation that is genuinely complex. And I want to say something up front clearly. I'm not here to promote surgery. I am not here to discourage surgery. I'm here to help you step out of the fear-based decision-making so whatever you choose is rooted in agency, safety, support, and self-trust. Real talk, no gloss, just us. Now let's dive in. Let's name why this decision feels so urgent and so heavy. Lipedema can feel like it's moving faster than you are. Even when you're doing all the right things, your symptoms can change. Pain, heaviness, bruising, mobility shifts, the way your clothes fit, the way you're treated in public, the way your nervous system tightens every time you have to explain your body again. And for many women, there's grief backed into it. I know that is for me. I didn't know this was lipedema. I thought it was my fault. I lost years trying to earn comfort, to try to get a doctor to listen to me. I knew there wasn't something totally right with my body, but I didn't have any support options. And that grief can create urgency once you find out, because grief wants to rewind the button. So once you finally find out that there is an intervention, albeit surgery, that's the only real intervention that they have found that actually stops the progression, There's many different people saying many different things. Hopefully they'll get closer to different alternatives, but research and what they show is the way to remove the diseased fat cells and stop them from growing in that area is liposuction or lipedema reduction surgery. That doesn't mean you won't get it in other areas. And sometimes it does grow back depending on how much they're able to get out. So, it is a gamble and a risk, but right now that's the only real intervention that they have for lessening the pain and increasing mobility. Then the next thing, the internet turns nuanced decisions into identity tests, doesn't it? Online, it could start to feel like team surgery versus team conservative care. And the reality is you're always going to have to do some sort of management conservative care. Once you have this, no matter what you choose, you're going to need to have support around you. Maybe not all the time, but in general, to keep the pain managed, to keep your mobility up, to keep the swelling away. There are certain things that you're going to just have to be lifestyle changes, just like if you had any other diagnosis that would change how you eat, how you work out, what you do, how you manage it. And one is not better than the other. Actually, a mix of both people have found that is best for them, but it really comes down to what you want. You might hear if you don't do surgery, you're in denial, it's going to get worse, or if you do surgery, you're taking the easy way out. But with lipedema and having this diagnosis, there's no easy way, really. There's no magic cure. And even people that have had success online to do alternative treatments, there's a lot of energy behind it. There's a lot of time behind it. There's a lot of trial and error behind it. Unfortunately, with this disease, it's always trial and error. Not everybody's body and their body responds the way that someone else's body does. Some things are not good for certain bodies to do certain sort of alternative therapies. And a lot of people, unfortunately, online that I've seen, they have had surgery and then promote some other sort of device or thing that has helped them. So my main point is listen to yourself, trust your intuition, and do your research because education is what's going to help you. It's not a cage match out there. It's not one or the other. And if you feel pressured one way or another, then turn off who you're listening to, talk to other people, find other types of support so you get a full picture. Your body is not this arena where it's like you have to choose one or another. And if you choose one way, then you're anti the other or you're against other people's things. It's really a personal choice. And this is a very painful disease. It can also be very debilitating. I know for myself, I am choosing surgery because my mobility and my pain, I just can't find another way to manage it. I've been managing it unknowingly for years. And some of those things have made it worse to eat really healthy. And I didn't know I had other comorbidities. But the less I'm able to walk, that and the more pain I am in, no matter wearing compression, doing all the conservative stuff for 2 years straight since I've had it, there's been no change. It's progressed a little bit, but not so much so in the volume, but my mobility is affected every day. So that's why I chose to do it, knowing that I'm still going to have to do these conservative treatments. And surgery is not a magic cure-all for everything, but it will. I'm guessing in a very researched way, looking at all the women that have had done it, reading lots of different studies, talking to lots of different people that have had the surgery. And the number one thing that, even if they've had other complications or things, the number one thing that they report is that their mobility got better and their pain decreased. And so that is why I'm going into it. So the other thing about going into this medical sort of arena again is finding doctors and physicians and a support staff that understand you, because medical trauma and uncertainty equals decision paralysis. So if you haven't been even recognized by your physician, or say you have some doctors that are just don't understand what it is and they haven't supported you, Going into any medical situation, especially major surgery, could be wrought with that feeling of an unconscious trauma coming back. Like, what if they're supposed to understand me? They're supposed to do this, but what if they don't? What if really I get told, X, Y, and Z again? Because when you've been dismissed, gaslit, misdiagnosed, and told just to lose weight, your nervous system may already associate health care with danger, right? Even if you're going to doctors that are supposed to be lipedema advocates. So now, when you're being asked to make a big medical decision inside a system that didn't protect you, of course you're spinning. Then here comes money. Money adds pressure that people don't talk about honestly enough. Even if you're considering insurance covered option, there can still be costs. If you're paying out of pocket, it can feel like if I'm spending this money and it doesn't help, I'll never forgive myself. If I don't spend this money, am I choosing pain? It's not shopping, it's survival math, right? And it can mess with your sense of safety. So first, let's just do a big exhale. If this episode has made you feel more panic, the panic you feel is not proof that you're behind. It's not proof that you need to make one decision over the other. It's proof that you care and the decision is real and you're taking some time to really outweigh your options. Now it's time for the connective thread, where the story meets the science. Let's zoom out and get grounded in what we're actually talking about when we say non-surgical lipedema treatment, conservative treatment for lipedema, lipedema surgery, lipedema reduction surgery, liposuction for lipedema. Lipedema care isn't a fork in the road, it's a spectrum. Non-surgical care can include things like compression therapy, so garments, wraps, fittings, manual lymphatic drainage, MLD, or lymph-friendly massage from a trained professional, movement that supports tissue health and nervous system stability, not punishment workouts, not working out for hours, actually figuring out if you also have hypermobility, EDS, or some sort of spectrum of hypermobility, because that also affects how you work out. And if you have POTS or if you have MCAS, all of those things go. So really figuring out, do you just have lipedema or do you have a cluster of symptoms and comorbidities that might affect one another? Also, pain management support, swelling management routines, that might be pump, legs up the wall, different sort of massage techniques after you go on a long walk, skincare, mobility supports, pacing, rest, then also emotional support, because chronic illness affects your identity, not just your legs, and surgery. Most often, liposuction-based approaches used for lipedema reduction may be considered for some people as a part of care planning, depending on symptom severity, function, access to aftercare, comorbidity, and personal goals. So that's a lot that I've said. So here's the key part. For many people, surgery is not a replacement for conservative care. It is often layered on top of it. And for the best outcomes, it's typically what I have researched and found to be true. It's not an either or framing already. That kind of, it's either one or the other, that already sets you up feeling trapped, because then you feel like you have to choose. And then that choice has more pressure. It's more weighted on the outcome. Because a lot of the time, the real question is, what combination of support helps me live in my body with more safety and less suffering so I can have more joy, do the things I want to do, and be as active as I want. It's not which side am I on. And if you've ever felt like when you're in any groups or listening to people and they're really down on surgery, just understand that's from their perspective, from what they feel for their body, and they're probably spreading education for alternatives. Sometimes I've been in groups and things where that hasn't really been what I truly felt coming from them. They really were anti-surgery, but I have to look at it that that's their perspective. And like this, I am open to both, so my perspective is open to both. I'm not close to either. If I was just team surgery, I might sound a little bit differently. Or if I was just team conservative care, I might sound differently too. We all live our lives through our own perspective and lived experience. For me, I really need a combination of both because I have really exhausted all of my conservative care and wishing and hoping and praying that one thing or a combination thing would miraculously change the disease fat that I've had in my legs since I was a teenager is wishful thinking at this point. Hopefully in the future, they'll do more research and there'll be maybe a combination of drugs or something that can help. I know Dr. Roxon up in Stanford is doing tons of amazing things that in the future there might be an alternative to surgery. But for me and right now, I don't want to wait and get worse. So you have to figure out what is going to be best for you. When you are deeply committed to your healing and you still not be ready for surgery, right? For me, I know I wanted to be in the best possible physical, mental, emotional health and shape I could be in to do this because it is the long game. Surgery is not easy and it takes over a year to really fully heal. And you have to do multiple surgeries, right? So you can still choose surgery and be the person who honors nervous system safe care, pacing, and long-term support. You don't have to prove your worthiness through your size or your decisions. So just because if you have lots of people that you know that have done surgery, that doesn't mean that you have to do that. And it also doesn't mean that if you do surgery and you had a different experience, that's negated. What I found, because I haven't been validated through any of my decisions, even though I knew something was wrong, I still kind of like second guess myself, like, oh no, am I going to do the wrong thing? I don't have a team of support around me. I always kind of feel I have to fight or justify my decisions. So, retrusting my body about doing these decisions is really something that I'm working on. And that is what I want for you. So, when you make a decision, you feel safe and trust yourself after years of being gaslit. It does that safety and that trust, that internal trust kind of has been a little bit skewed. So sometimes it's hard to hear, are you really listening to the voice inside of you? Or are you also have that years of being told like what your reality is not true. So you're still kind of gun shy with that. And if you're still researching and in that fear loop at 2 a.m., you know, you watch maybe before and after videos a little too much. You swing between hope and dread. You screenshot surgeon quotes and then feel a little nauseous. And you tell yourself that you have to decide now. Or if you really want to have this done, then you have to wait 6 months to get a consultation. And then if you do insurance, that might be 7 months to a year. Or after the consultation that you took 6 months, the surgeons are booking out a year. So then still there's so much time where you could go back and second guess yourself. So before we talk about what to choose, we have to talk about how you're choosing, right? Because you're not being dramatic. You just have a dysregulated system anyway, probably because you have a connective tissue disorder, which just has some level of hypermobility. And that connective tissue disorder is a dysregulated system. So you're trying to find certainty. So you have all these things stacked up kind of against you. So when you're trying to figure out your best path, so that's why there's sometimes a lot more anxiety or indecision and that fear loop of, and then even after you have the surgery, if it hasn't gone exactly how you want it, you might be back in this fear loop. So this is all just trying to help you figure out how to stay grounded in what your decision is so that even if 6 months after your surgery, if that's the route you try, then you're not, oh my God, why did I do this? I can't believe I did this. I'm so dumb, da da da, all of those things. And really knowing that lipedema reduction surgery is like the first step. Actually, when you get the surgery, you have to look at a year, 18 months after it to see if it works or not. It's a really long time. That's why I would not wish this disease on anyone because there is so much, nothing is fast with it, right? Everything is slow. So you really have to find different ways to take care of yourself in these super long periods of time where your mind could come in and just act not like a friend, but more like a predator. Because if you make any decision of panic or feeling pressured, then you're never going to feel peaceful, even if it's the right one. Mythbuster. Less hype, more help. So let's lovingly set a few myths down on the table and take their power away. Myth 1. If I don't get surgery, I'm going to get worse. And I'm failing at something. I'm not doing something I should for my body. No, that's not true. Non-surgical lipedema care is not a consolation prize. It is legitimate, meaningful care, especially when it improves pain, mobility, swelling, and quality of life. Surgery is not just this thing that is going to make everything better. In some cases, it may not be the right thing for you. So just know that opting for whatever care and how you piece it together is the best thing for you. It's not one or the other. Myth 2, if I do surgery, I'm taking the easy way out. Also, no way. Surgery is not easy. Lipedema is not easy. It's planning for the surgery, the recovery, the aftercare, the compression. There's nothing easy about this. Swelling management, body changes, nervous system stress, logistics, cost, time. If you choose surgery, it's not you're weak and you can't push through it. We have been told so many times to do something that our bodies actually couldn't do. So it's normal to feel like, oh, if I just do this one, then I know there was something inside of me of thinking like, oh gosh, I don't want to do surgery because like I said earlier, I was hoping that some magical thing I would do and maybe everything I've been reading and the doctors told me they were wrong. For me, I'd have this eat this thing or not eat this thing, and then the fat would melt away. And that's just not true either. When you make a decision that you want to do surgery, and if you choose it, you're making a strategic decision for your body, for yourself, and for your quality of life. Myth number 3, surgery cures lipedema. So this is where language matters because there's no cure for lipedema. All the doctors, anything, there's way to treat it, manage it, hopefully stop the progression. But for right now, there is no cure. People have different experience and different outcomes. So just if they're able to reverse their lipedema to a different stage, awesome. But that doesn't mean it's cured. It's not gone. There's no cure. Absolutely. There's maybe products, maybe ways of doing things, maybe something out there, but nothing is actually going to cure it. You're always going to have it, and it's always something to be managed. And I'm not here to be Debbie Downer, but the truth is, if someone's saying they're curing something with lipedema, that's not true. Not yet, anyway. Lipedema is considered a chronic condition, meaning it's long-term management, and that is what still matters no matter what you do, whether it's surgery or conservative care. You have a different body. It responds differently into the world. So all the normative things that medicine and dieting, exercise, feeling good, blah, 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 it doesn't really have the same effect on a body that has some connective tissue disorders, lymphatic issues, etc., because our bodies just respond differently and there isn't a system out there that really tailors to us. So when we put normative sort of medical things on top of how we're supposed to be, which we've done, I know I've done for 50 years and it doesn't work, we start to feel like the problem's us. And really it's not. It's just we have to have a complex, our own support team with like 10 different things, not just one. And if someone is selling you one and done, then be skeptical, right? Then myth number 4, conservative care doesn't work, so it's pointless. That's also not true. Conservative care is very helpful in many things, and it may not make the lipedema disappear, just like surgery may take some of the disease fat out, but you're still going to have lipedema. Conservative care doesn't take that lipedema out, but it can absolutely support your function, pain reduction, swelling management, tissue health, mobility, nervous system stability, and your own sense of agency. Again, it's not a cure, but it doesn't mean it's not worth it. And that's really, if you adopt this lifestyle, once you have it, you're going to have better outcomes through word of mouth. And people just, there's not a lot of research, but it does show. But if you have lymphedema, then a lot of these companies that have now made lipedema support, so compression, etc., they're cousins of each other. So some of that research pertains to the swelling, the management, the pain of having compression, doing different techniques to help with that. So the bottom line is anything you choose is not weakness. It's the best for you. And trying to step out of this fear loop is really where this program is about, is because there's so many good results and quote unquote arguments for both. But really, when I have talked to people individually, trying to figure out if I wanted to do surgery, where I wanted to do surgery, what my doctor told me to do all these conservative things right away, and I did. So I've been doing them. So I'm sure well, I can't say because you can't go back and if I didn't do them, would I be worse? But doing them hasn't improved me so much that surgery wasn't an option. So now surgery is on the table. And what I'd like you to try to think of is instead of thinking surgery or no surgery, try this question: what would make my next step safer? And safer could be getting properly assessed by a lipedema informed clinician, learning your stage and symptoms without catastrophizing them, getting a compression fitting so your compression actually fits and starts to help, figuring out why the compression is open toe at your toes and not just your ankle, even if it's uncomfortable, really getting educated on the best practices, being realistic about a movement plan so you don't flare up, figuring out aftercare support and how that would be available if you choose surgery, stabilizing other conditions first, MCAS, POTS, EDS, hypermobility, or if you're like me and you have ME/chronic fatigue syndrome. A lot of times those show up. Sometimes fibromyalgia does. It doesn't have to. Sometimes it's mixed diagnosis of that. So it's very complex. But figuring out what your things are so you can make sure that you're managing them as well. They all affect each other. Safety is a step, not a switch. So to create a decision container, your brain will research forever if you let it. So set this container example for the next 3 weeks. Gather information from only these sources, right? So pick where you want to find some sources, gather that information, and do a deep dive. And then next, schedule 1 to 2 consultations for education, not commitment. So if you're looking for different doctors, do 1, 2, 3, as many as you can. Get all their information and find out how they speak about lipedema, what it is, and how their care, and take all that as education. So if 3 doctors are saying 3 sentences of the same, then think okay, so those are the things that I should look at. So really do your own research. And then allow yourself to pause your research. On weekends, give yourself some time in between. Even if you feel pressured to oh my God, if I don't do something now, then I'll get worse. Try to pull that back and just be okay, I just need to take the information that I have learned, let it simmer for a minute, and then go back and see okay, what resonates with me? What does my body need? What does my life circumstances need? And just really stop scrolling on and looking at different people's ideas. Remember, social media shows a lot of ideal outcomes with things. A lot of people do share in their lipedema journey. I know I try. I'm not great at social media, but I've wanted to really show the realistic parts of it. But when I'm not feeling well, I don't have the energy to film anything, to show anything. So I'm not doing that great of a job. And just kind of remember it's only a few seconds of someone's life, right? So look at it more as how it's going to affect you. And then build a plan that's both and. So both/and. Even if you think you want surgery, most people will still need some non-surgical supports afterwards. And even if you don't want surgery, then you have a plan that feels okay, this is going to be. It's hard to have it's a sentence, this is how it always has to be. But just remember, the more it's part of your lifestyle, integrate one non-conservative or non-surgical, but one conservative treatment every few months or whenever you're ready. Just start with one, not all of them. And then it makes it more doable once it gets part of your lifestyle. But it takes some energy and planning and execution and commitment. And some days you won't feel like wearing your compression, and just know that there's seasons But if you get that part of your lifestyle, it doesn't have to be perfect. Remember that as well. None of this is like it's the perfect choice because lipedema is not perfect at all. Feel good flow time, micro moves, macro reliefs. Let's breathe together. So try this. Plan A, support now. What helps you this month? Plan B, explore options. What information do you want to get before you decide anything bigger, like any bigger decision? Plan C, if I choose surgery later, what would I need to have in place now to make my recovery safer? And this is how you get out of this binary, right? One or the other, and out of that loop is make room for the truth that I am not ready is also a valid answer. So read that again. Hear that again. I am not ready is also valid. So if you're not ready to make any decisions, that's also a decision, right? And then you could take some pressure off yourself to explore some things again. Go back again, reread different things, go back, explore different things because not ready doesn't mean never. It just is like you're not ready right now. If it's too much pressure to try to figure out, or if it feels too overwhelming to figure out a diet, figure out compression, figure out a pump, all these things, right? Because there's a lot of things. Just say, no, I'm not ready now. That doesn't mean that it's going to get worse because you really don't have to make a decision, especially out of fear of pressure or this loop of like, oh no, this disease is so overwhelming. Take your time and give yourself permission to have it be like, I'm not ready. I'm just not going to think about it right now. And then when you're ready, come back to it and see what percolates as the first thing to come up. Because that also, when you're not ready, your body's also asking for timing, support, and capacity, right? The readiness isn't just emotional, it's logistical. Do you have aftercare access? Do you have help at home? Can you take time off? Do you have a provider that can get you through your insurance, total decongestive therapy that could get you measured for compression, et cetera, et cetera. And if you have core mobilities, they might need stabilizing first. So think MCAS, hypermobility, POTS, etc. Like in my case, I really needed to figure out how to treat my ME/chronic fatigue syndrome because that is really going to affect my aftercare, right? So you're not overthinking, you're just protecting yourself. And so also don't let shame be your surgeon either. If your decision's being driven by embarrassment, urgency, panic, I have to fix this, to XYZ. If there is a wound that says I have to fix this so I can be lovable, or I have to spend money to prove that I'm trying, I want to look like so I have this thing, I want to look like I'm doing something for it. Try to pause and just let shame release whatever kind of strange shame association. So those two things that I just said might seem like, oh gosh, that's not me. Why would she say that? But shame does weird stuff. It makes us think weird things about ourselves, about how people perceive us, what we should be doing. So shame is not a medical professional. Shame doesn't get a vote. So next, just let the goal of your quality of life guide you. So not being perfect, not being a perfect body size, not having my legs be a perfect shape, but really what is going to improve my quality of life at this point in my life? And for me, surgery is a part of improving my quality of life. For others, conservative care may be the most supportive choice right now. I know that was me in the beginning. I didn't want to jump into surgery because I didn't know enough about it. And I'm really glad I didn't because then I wanted to also learn how can I manage this thing? What can I do on my own that I haven't been doing that's been affecting my symptoms? I needed a lot more education. So the question is, how do I live in this body with less suffering and more support? And that's the goal. That's the compass. How do I live in this body with less suffering and more support? So with those questions, let's get out of the head and into the body. And just if you have some time, just place one hand to your chest and one hand to your lower belly. Try not to fix anything. Just locate yourself. Exhale like you're fogging up a mirror. Longer in than out. And do that as many times as you can. 3 is always a good number. And as you do that, just now try to go into your body. Feel your toes, let them wiggle, do some ankle pumps, slow and easy. Just waking up your lower legs without forcing circulation like a drill sergeant. Then unclench your jaw and let your tongue relax. Because your lymph doesn't drain better when your teeth are auditioning for a vice grip. So just make sure if you can get that jaw really relaxed and help that flow. And say quietly in your head, I'm allowed to choose slowly. I'm allowed to choose safely. And that's it. No big performance, just a signal to your system that you're listening. This is shared education and lived experience, not medical advice, and is not meant to be. Check in with your body, check in with your clinician, and find out what fits your life. So if you're navigating lipedema surgery versus non-surgical care, I want you to hear me. You're not behind, you're not failing, you don't have to make a choice. You're not required to choose at all, and let alone from a place of fear. This isn't a test of your toughness or the best decision making. It's really about your body's decision, and it deserves time, tenderness, and clarity. And if you don't have lipedema, but you're listening because you're stuck in your own health decision loop, same message. You don't have to bully yourself into uncertainty or into certainty. You don't have to bully yourself into certainty. You can gather information and still honor your capacity. So you could gather information and not do anything with it, right? You can want relief and still choose safety. So even if you want things to be different, maybe you don't need to go in guns blazing. Just take one thing at a time, or just take your time. And when you have the capacity to do this, because it takes a lot of energy. And if you have lipedema or any of those comorbidities, you just don't have the energy. It's a full-time job, really, or at the very least, a part-time job to manage these things. So take time, take your breath, go back always to that 60-second thing. Just pause, breathe, and know you don't have to make a decision. And that is always a decision. That's the only decision. If you're not ready, you're not ready. And that's a beautiful decision right there. So thank you for being here. And if this episode helped, send it to a friend also that's stuck in that too. I have to choose spiral, because sometimes the most healing thing is realizing you're not alone in the mess of it. And I'm Donna. This is Dear Body, I'm Listening. And whatever you choose next, let it be rooted in agency, not shame. Goodbye for now. You've been listening to Dear Body, I'm Listening. Now it's time to remember to be gentle with your capacity. Meet yourself where you are. And if this has helped, send it to a friend who also needs a soft reminder and a gentle place to land. If this episode made you feel even more seen, brought you clarity, or reminded you that you're not alone, please take a moment to rate, review, and send it to someone who needs that same reminder. You can find more tools, blog posts, and support over at donnapiper.com. And hey, don't forget to subscribe so you never miss an episode. Got a question for me? Every month I do a listener coaching episode, and I'd love to hear from you. Send your questions, stories, or flare-up confessions to donna@donnapiper.com. And you just might hear your answer on the show. Until next time, dear body, I'm listening, and I am so glad that you are here.